For my philosophy forum, I decided to do over-the-counter birth control. My guiding question is, should birth control be over-the-counter or do you need a prescription? So what is birth control? Birth control is a type of contraception that is designed to prevent pregnancy. The pill is a daily medication that contains two hormones called estrogen and progestin. Of the 72.2 million American women of the reproductive age, 64.9% use a contraceptive. Of those, 9.1 million, or 12.6%, of the contraceptive users use birth control pills, which are the second most commonly used method of contraception in the United States. Women who take the pill have to take it every day so it can work to its full potential. Even if you miss one day, it won't work as well or could cause some pregnancy scares. There are definitely some side effects to birth control, but not all of them are bad. This pill has many perks besides preventing pregnancy. The pill can help lessen or prevent acne, can help with PMS, which is premenstrual syndrome, and the hormones in this pill also reduce menstrual cramps. Because birth control is a prescription drug, and because the Affordable Care Act requires insurance companies to provide no copay coverage for birth control, American women typically don't buy the inexpensive pills directly from a pharmacy, as women do in most other countries. American women typically use a third-party payer, like an insurance company, to pay for their contraception, and often employers provide health insurance. Taking the pill is super easy, but what a lot of women have trouble is is remembering to take it every day. But luckily, the pill case is super small and they can take it everywhere they go. Controversial. The pill is currently available by prescription only, and a debate has emerged about whether the birth control pill should be over the counter, which means the pill would be available along with other drugs such as Tylenol and Benadryl in drugstore aisles. This would be easier so you don't have to go to your doctor's office to get a prescription. You can just walk into your local pharmacy and pick it up. People who want birth control pills over the counter say that doing this would actually lower teen pregnancy rates, provide contraceptive access to medically underserved women, and ease access to health-improving drug in decades of safe use. Then there are some people who don't want birth control to be over the counter. They think that if the pill was over the counter, it would raise the cost of the contraception for women. It would pose a danger to teens and women's health by removing the doctor's visit requirement. It would also limit what options are made available. To narrow down the age gap, I believe that women should be 17 or older to be able to buy the pill over the counter. A pro of birth control pills being over the counter is they're much safer than many other over the counter drugs. Between 9 and 10.6 million American women use the birth control pill. The pill carries no risk of overdose or addiction. According to Bedsider, a nonprofit online birth control network run by doctors, as medications go, the pill is very safe. Safer than having a baby, driving, smoking, or taking a daily aspirin. Joe Spidel, who is a professor of obstetrics, gynecology, and reproductive science at the Bixby Center for Global Reproductive Health, explains that pregnancy has a mortality rate about the same as car accidents, 1 in 8,300, while the risk of dying from birth control is about 1 in 1,667,000. Other over-the-counter drugs carry more serious risks. Like ibuprofen can cause stomach bleeding, Sudafed can raise your blood pressure, Tylenol can cause liver toxicity, Benadryl can worsen glaucoma and kidney disease, and diet pills can cause irregular heartbeats and raise your blood pressure. A con to birth control being over the counter is it would actually raise the price of the drug. Breaking birth control pills over the counter would mean they would no longer be covered by insurance and women would have to pay for them on their own. The National Women's Law Center estimates that 62.8 million women have birth control coverage with no out-of-pocket cost. Stuart Schweitzer, who is a UCLA professor of health policy and management, stated that over-the-counter is more expensive to consumers than a prescribed drug that's covered by insurance. Before Plan B contraception went over the counter, the cost of the drug was about $12 for the brand name and $5 for the generic for women using Medicaid. After the drug became over the counter, the cost increased to $50 for the brand name and $41 for the generic. Here is a graph of the average cash prices for birth control through February 2017 to January 2018. So starting in February 2017, you can see how it was about $79 for birth control for the cash price. And then starting in June 2017 to September 2017, it kind of went up and down on the price. And then in December 2017 to January 2018, it rose to about $85 to $86. Birth control is covered by insurance for most women, but in some pills cost around $20 a month, but there are others that can cost around $100. Another pro is most women want over-the-counter access to birth control, and they say that it would actually improve their lives if the pill went over the counter. So 62.2% of women surveyed indicated that they were in favor of the over-the-counter pills. The same survey found that 28% of women using no birth control and 32.7% of women using a less effective form of birth control would actually use over-the-counter pills. 78.7% of women said it was extremely important that birth control could be easily obtained. More statistics show that 62.5% of women surveyed said birth control reduces their stress. 56% said it helps working women continue to work, and 49% said it helps women get an education. Research supports these women's conclusions because state laws that allowed early access to the pill, which are to 17 or 18-year-olds instead of 21, are linked to higher women's college graduation and unemployment rates. They increased earning power, narrowed the gender pay gap. Over-the-counter birth control pills would also be more convenient, eliminating the need for women to make doctor's appointments and take time off of work to rearrange their schedule just to go to the doctor's office. Another con, if birth control was over the counter, is it would actually decrease someone's privacy. So if birth control pills were available on pharmacy aisles, purchases would be public and people could judge others for buying it. Many people may prefer to keep their contraceptive use between them and their doctors. Olivia Apperstein said that the concept of over-the-counter birth control ignores the reality that not all people can just go to the pharmacy and easily purchase birth control. Some face religious and social backlash for buying pills in full view of their pharmacist and people from their community. Some are young and under a certain state law, and they can't just purchase birth control without their parents' consent. Teens want their contraceptive use to be kept private, and accessing birth control in the middle of a pharmacy where they might run into their neighbor or teacher could stop teens from preventing pregnancy. Another pro to birth control being over the counter is major medical and rights organizations support the pill being over the counter. The American College of Obstetricians and Gynecologists stated that they have long supported over-the-counter access to oral contraceptives. Birth control is an essential part of a woman's health care, and the over-the-counter status would help women benefit from the ability to control their own reproductive health. At least 89 major medical and rights organizations support the pill being over the counter, including American Academy of Pediatrics, American Academy of Family Physicians, the ACLU, National Women's Law Center, and Planned Parenthood. And the last con to birth control being over the counter is birth control pills do have some serious and sometimes fatal contradictions, meaning not every woman should take them. When a drug is over the counter, 49% of people get information about the drug from mass media, and only 27% of those people actually contact their doctors with questions about the over-the-counter drug. This lack of communication and lack of awareness of contradictions can put women at risk. Poppy Daniels called over-the-counter birth control without doctor involvement ridiculous and absurd. She stated that my concern is that you're basically taking women who have no counseling and no family history, and they're just getting their hormonal birth control without any guidance. If the pill is prescribed, the doctor or pharmacist can tell the patient about any possible interactions and prevent bad drug combinations. So my activity and discussion is going to be discussed in class tomorrow, and